everybody, and thank you very much for coming out tonight for our annual community meeting. And it's an opportunity for us to really share what is happening within Miners Colfax Medical Center, but also to answer any questions you may have. And I know we do have a small audience tonight, and more will be coming in, but we are going out live on KRTN. It will also be posted on our website. And the intent is really to make sure we're educating and informing those that we serve. So again, thank you for coming out. So tonight we want to talk again, Miners Colfax Medical Center, our report to you, the communities that we really serve. And we have a history of caring and truly a future of promise, and that is part of our motto. We are one organization. We have many areas that we serve, many facilities, many services, but we have one mission around that and one direction, and we'll talk about that. So on the agenda tonight, we absolutely want to talk about our mission, the values that we prescribe to, our strategic initiatives, of course, our primary care clinic, our exceptional medical team, the recruitment that is underway, our services overall, different quality initiatives. We want to talk about the investment in the communities that we serve. Also share, again, being very transparent, our financials. Then talk about our exceptional auxiliary, the medical foundation, and then answer any questions you may have. Sorry. So, the mission. I was talking to Cecil up here a little bit about our history. Remember, we really were founded before we were a state. Back really in 1898, under the Ferguson Act, the federal government, as we were a territory, set funding aside through land grants. Now we have 100,000 acres of land that helps support the miners' services. And with that, the original hospital was built in 1904. But a little trivia for you, it actually didn't open in 1904. We didn't open until 1906. And that is because we ran out of money and they couldn't equip the hospital. So much as we have now an exceptional community that supports us, the community came together and really raised the money needed to outfit that hospital. It opened in 1906. So the mission of the center, we are, of course, a healthcare agency of the state of New Mexico, but we want to be a leader in providing that exceptional care and service in acute care, long-term care, primary, and other related services for the beneficiaries of that trust, the people of northeastern New Mexico and all the surrounding region. We serve a large geographic area, and we take that mission very importantly. Our values, again, we are committed and subscribe to these 5 core values that we live out every single day, and as I say, every single way. With that teamwork, we cannot accomplish anything without a commitment to each other and supporting each other. And that is through very active, open, and engaged listening and communication. We really commit to providing exceptional quality throughout everything we do. We want to be dependable, relied upon, doing what we say we're going to do and following through. Then, of course, being honest and transparent in all of our actions. So, we line up as many organizations to help around our pillars because it defines what we should be doing and why we do those things. So quality and service is our first pillar, foremost. It's absolutely our essence and what we are. We commit to providing the highest quality, the highest safety for everybody we serve. Then, of course, our people, and that's every team member in our organization committed to making sure we fulfill and strengthen their skills, strengthen their knowledge, and improve our ability to serve others. Then growth, constantly looking at how we can improve where our services are and identifying new areas to better serve those throughout the region. Then minor services, again, right back to 1904. That's why we were founded, and we will not stop serving minors and advancing that care and service. And communities, making sure we are there, we are part of the communities for this entire region, being an integral and supportive partner in that. And then, of course, finance, making sure we do have the strong finances to support those initiatives and ensuring we're here for the next 120 plus years. So with that, the foundation, of course, are our team members, the medical staff, our wonderful board of trustees, the auxiliary, and our medical foundation. Supporting those pillars, interwoven, again, are those values I talked about in how we support each other for our patients, residents, the families, the visitors, the caregivers, and ultimately the communities that we serve. So, MCMC, who are we? We are a 25-bed critical access hospital. We're a full-service hospital. Critical access just defines how we are paid on a federal level. We absolutely provide all services most hospitals provide. We were recognized this year as a top 100 in the nation for critical access hospitals out of 1,300. That was a phenomenal accomplishment for our team, and we'll continue to strive on that journey. So within the hospital, of course, we have emergency services, we have surgical services, medical surgical inpatient, we have intensive care, obstetrics and women's health, we have medical imaging, laboratory, and respiratory therapy. Then, our 1-year anniversary, we're also here to celebrate, right, of our primary care clinic. So that, and including our specialty clinics with surgery. So long-term care over at the old hospital, right, 1904, and they've done an exceptional job maintaining it. But it is historically ranked top in the nation. And this year, again, we were recognized of 3,000 other similar facilities on our rankings, top 5th in the nation. So again, huge congratulations to the team and the support and dedication to those residents and making sure they have the highest quality of life. So within long-term care, there's the intermediate care and there's assisted living. And then, of course, our Black Lung and Respiratory Disease Outreach Program, and Candace Evans and her wonderful team make sure we are the national leader, not only the services we provide, but the research that we do, and we'll talk about that also. So, we'll briefly go over our strategic initiatives, and this carries us through 2018. And Paul Jenkins is here in the audience, and he was really a wonderful asset in helping strive for these and really making sure we had lofty aspirations. So, behavioral health. Establish regional behavioral health programs with community partners to provide the comprehensive behavioral health continuum of care. Career pathways, making sure we are developing the young, making sure we provide opportunities and careers here locally. So through that, we further develop with regional schools on potential healthcare careers throughout. And customer service. We want to be the center for exceptional service measured by our national survey company, NRC. We are striving now to be above the 65th percentile for our acute care and overall recommending us to be exceptional. Finances. Of course, like I said, we want to be strong financially. Our goal in 2015 was to make sure we broke even. There's a lot of changes with Medicaid and Medicare reform. We accomplished that. Then we wanted a 2% operating margin in 2016. We accomplished that. Now we're shooting for 2017, a 3% operating margin. Government collaboration. We want to educate the legislative team, government officials, and all of our partners down in Santa Fe and at the federal level. Pulmonary. Again, by the end of 2016, create that nationally recognized Black Lung Pulmonary Disease Program, which we have. Now we're going to advance and grow that as we develop a new cardiopulmonary and research body around that. Recruitment and retention. It's paramount that we are striving, improving the team members we bring in, keeping those, because right now we lose many nurses to other facilities, other highly skilled individuals in healthcare to other agencies. So what we can do to reduce that turnover and keep our core and committed team members. Team training. We want to create a comprehensive training program for all employees, including our managers, and striving around quality. We've just joined Quality New Mexico to advance our training throughout the entire organization. And then outpatient services. We want to expand our primary care, expand the access to care, and we'll continue to strive for that. So, with our primary and specialty clinics, services in pediatrics, we have Dr. Leonardo Lopez and Dr. Haris Kazmi. Family medicine, I'm happy to announce, Allison Gagnon is a new nurse practitioner who will be joining us here in September. Internal medicine, again, Dr. Leonardo Lopez and his wife, Dr. Christine Lopez, who's in the back with the girls, wave. Geriatrics, Dr. Christine has a specialty in gerontology. It's a wonderful thing to have, especially in a community like ours, really striving to provide the highest level of care. The obstetrics and women's health, we do have Dr. Roberts, Dr. Luisa Chavez, and Dr. Mary Van Sickle, who provide those comprehensive services around obstetrics and women's health. Surgical services, Dr. Angel Wright and Dr. Stan Chow do an exceptional job around general surgery, and we do very advanced general surgery here. They're just wonderful, very highly skilled people. Then partnered services, Dr. Rastrelli and Dr. Bagwell. Dr. Rastrelli for eyes comes in and really helps with that, and Dr. Bagwell on oncology, providing that comprehensive care. Then we have the medical directorship of Dr. Douglas Schmidt. So overall services, what we're looking, again, not only to strengthen, but to grow. Cardiology, I'm happy to announce, is finally returning September 8th. Dr. Guru Lay and Dr. Koo will be coming out of Albuquerque and serving us twice a month for an advanced cardiology clinic. And we're really looking to grow that and provide more comprehensive cardiology services that have been offered in the past. Oncology will continue to grow that. Darlene Longbine over there, hi Darlene, wave. She, again, is really growing in oncology and her skill sets and working closely with New Mexico Cancer Care on that coordination. Pulmonary, again, as we work with University of New Mexico and Dr. Akshay Sood in what we develop around not only the minors' services, their research, but also for the entire community. And I know Dr. Sood is spending more time on overall pulmonology and advancing those services. Also, pain management. This is becoming a national issue on how we can best serve those who need chronic care and chronic pain management. So we are bringing in a new pain clinic here with our certified nurse anesthetist. So they will be providing this twice a month and being able to come in and manage people's pains and helping them get off narcotics. So it's helping manage pain a lot more conservatively. Then medical air transportation. I'm happy to say we did have the transition with our helicopter where the company we're using was bought out by a larger national company. And Air Methods, that new large national company, is committed that they want to be here. They see the need, the growth, so they'll continue to have a helicopter permanently here to serve us. And it really helps making sure if people have to be transported to a higher level of care, they're able to quickly get them triaged, stabilized, and to that higher level of care. The other important part, though, is as we advance our services and clinical capabilities for our trauma level, because we do see a lot of trauma in this area with the interstates, with the potential with Amtrak, and many other things. So having a trauma level 4 designation means we are well prepared for traumas. Our team has higher skills, we have more resources and capabilities to serve those needs. And our goal this coming year in the emergency team is to go to a trauma level 3, which is even higher quality. Now I'm happy to say we're only the 3rd trauma level 4 in the state, and again, there's only 2 other trauma level 3s in the state. So that's our goal, to continue to improve that. So recruitment and future focus. Physicians, we absolutely, of course, need more family practice with Dr. Caruana announcing his retirement and Dr. Condor announcing in December she will be retiring. So we are focused to bring another family medicine physician who can help Dr. Leonardo Lopez and Dr. Cosme with pediatrics and around all of family medicine. We're also looking to bring in our own psychiatrists to help not only behavioral health on an outpatient side, but for our long-term care services and the services for the entire region. Specialty areas for partnership we want to look at, definitely urology. We cannot support full-time urology, but we want to partner and have them come here on a rotation, along with advancing our oncology, expanding, looking at orthopedics, more focused here, and then along with behavioral health, advanced counselors with that. So, what is primary and behavioral health integration? We talk about that, but really it's looking how we can expand our primary care and the coordination around that access. So it is our primary care physicians working with counselors, psychiatrists, psychologists to manage the person as a whole person, looking at all of their healthcare needs, not only physical, but behavioral. So that is what we're looking to develop for the outpatient. We did, when we built our new clinic, expanded it and built space available to go into that at a future state. So we will be building on and remodeling that area at a very low cost to bring in the behavioral health on the outpatient side. So this means improved coordination and better communication, part of our values. So before I go on to that, I do want to acknowledge, because Dr. Leonardo and Dr. Christine came in while we were talking about the primary care. I really want to acknowledge those two because they have stepped up so much, as Dr. Caruana did announce, but that team and their entire team is along with them with the clinic has really strived to improve the quality, to improve the access, and have done so much trying to make sure we fit people in while we're recruiting. I don't want you to think we've stopped. Again, I talked about Allison Gagnon is coming, and I'm happy to announce, she's not here yet, but Lisa Wentling, physician assistant, has committed to coming here November 1. So she will also join our clinic, which will be a tremendous addition to this wonderful team back there. So again, Dr. Lopez's and the entire clinic team, thank you for everything you've done for us. I appreciate it. Also, there's Dr. Cosme and the other team. Thank you very much. You were hiding in the dark. Thank you again for everything you've done. Thank you. And Dr. Chavez is sitting back there with the Women's Health, wave at least. Thank you very much. So again, this team has committed to making sure we provide great care and commitment to quality, but it is a journey, right? It's continuous. So this just shows some of our marks, because nationally we look at how we compare to other entities, other clinics, other hospitals, other long-term care. And here you can see we are doing well in many areas, but there is, oh, it's not going to come up, but there are areas around. You got an answer after calling the clinic after hours or during. Those are lower, below standards. So those are initiatives we're working on to improve, okay? Continuous improvement is important here. Also, with the emergency department, we have really grown. I've told you in the past, 3 years ago, our emergency department, I will say, was not meeting the standards we wanted. We were not employing the right physicians. So we made that determination and strategic initiative to employ and partner directly with all physicians in the ER. Since that time, we've gone from the bottom 10th percentile up into the 70th percentile nationally in quality and service in our ER. But we won't stop, and those marks show it there. So again, that commitment continues. For our inpatient, we continue to strive and improve areas where we've added hospitalist services and making sure we're better communicating with individuals. Because one of the complaints, and it's still an area we can grow in, is about medication. When you're discharged from a hospital, on average, they discharge you with 10 to 12 medications. So knowing what you're going home with, making sure you know what to stop, what to continue, and what to start. So those are important initiatives. I know we're working with our pharmacy team as they're doing more bedside rounding and educating not only the patient, but their families and caregivers. On the outpatient side, with our medical imaging and laboratory, making sure we continuously show compassion and respect. One of the big areas of growth is knowing when and where you can get your results. Knowing it's going to take 2 to 3 days, or that you need to follow up with your physician and when they'll have that. So better communication in those areas are wonderful areas we're striving in. So, community investment. Absolutely, we made a huge investment in providing more access to care by building the new primary care clinic. That was $3.2 million we completed last year. Along with the new capital equipment we built. With that, our new CT scanner, which hopefully if no one's using it after I get done talking, you'll be able to tour and see this new wonderful diagnostic piece of equipment. We went from 16 slice to 64. You say, what does that mean to me? It means it's faster, it means it gives a cleaner image and a higher quality diagnostic capability. Now we'll be able to really look from a cardiac standpoint, do you need to be transferred? Do you have to go to a cath lab, or can you be managed here and stabilized and cared for and go home appropriately? The other thing, a new ultrasound, they call it 4-dimensional because there is motion involved, but the latest, greatest, highest quality ultrasound machine at $150,000. And that's part of our commitment, not only for advanced diagnostics, but to obstetrics and women's health. Also, we are investing this coming year in a new central monitoring for our moms and babies. And the wonderful pink ladies here, our auxiliary, are helping us with that commitment as we do that capital campaign to purchase this. So continuously monitor. And Dr. Chavez will be able to pull up on her iPhone, on her computer, what is happening with that baby so she can continuously be tuned in. And then along with our microbiology in laboratory, we advanced and put in $200,000 of new equipment to bring microbiology back here local, because in the past it was sent out to Albuquerque and it would take 3 to 4 days to get the results. This is more real time and monitoring. So we want to talk about other initiatives for our community. As I talked about, growing, developing, providing opportunity for the youth. So Recruit, Train, Retain, and Sustain program is a federal grant to strengthen allied health care in rural areas. Union County Network achieved this grant last year, and we are partnering with them to advance specialties and medical technology or technologists in the laboratory, respiratory therapists, physical therapists, medical imaging technologists, and EMT paramedics. This is going to help us work with local students, bring them along and advance their career, and give them that support both financially and clinically. So here's the financial report, so wake up. So our income statement, what is up there? An income statement really tells us what you brought in for patient care and other related services, what you deducted, because as you know, what we bill, insurances, Medicare, Medicaid does not pay, so we do what's called contractual adjustments. And then we look at what's uncollectible, and then what the overall other revenues were, and then total operating revenue. So again, last year, we billed out $25,600,000, okay? This year, we billed out $34 million. So a large, large increase. We did have a larger increase, of course, in contractual in our adjustments, $10 million last year, $14 million this year. Uncollectible, and so this was a big initiative for Peggy Martinez, our Chief Financial Officer, and the revenue team. They looked, because there were many accounts sitting with our company that collects overdue bills. Now, we had located, because we switched companies, our new company came in and said, you've got accounts out there from 1997 that were uncollectible. So we did a large, really purge. We looked at all the old accounts and really said, these are bad debts we cannot collect. So that was a one-time large write-off, okay, of $4 million. It was money we really didn't even have, but it was just sitting out there, okay? So that was an important initiative financially to make sure we got those things cleaned up, and we're really making sure we're striving on improving our revenue cycle. So with that, last year, after those adjustments, we collected net patient revenue, $15,600,000. This year, we collected over $16 million, even with that large write-off. The other on then operating revenues, so other things, including the state gives us additional money called Safety Net Care Pool, because we are a sole hospital serving a large Medicaid population. So we do get additional money. Last year, about 4.6 million. This year, almost $6.4 million in other revenue. So total operating revenue was 20.2 million last year. This year was 22.5 million. So again, growth and increase. This just shows you a busy chart, but I like to show the red is 2016, the blue is 2015 in many core service areas, and you see growth in every single area. We saw an average for the entire organization 34% growth. That is phenomenal, and it's because of these team members in this area, in this room. So we're very appreciative of the hard work and commitment of numerous individuals. But with that, I broke it down even further to show you a couple core areas and great growth. That first line is 50% growth. That would be tremendous in any organization. But because of Candace and her team's hard work, her Black Lung and Outreach Pulmonary Disease Program saw 258% growth this past year. So that is a little bit skewed at that end, but just tremendous. But in all other areas, between 50 and 100% growth in those core areas, and will continue. So here's our operating margin. I showed you revenues, but did our expenses outweigh our growth? And no. A great thing in 2015, just so you know, accounts payable are things, all the bills we pay. That was $13 million in 2015. Then our accounts receivables, those that we put into state and for our receivable accounts, $23 million. State entries, miscellaneous updates, 163. We are appropriated every year from the Miners Trust certain amount of money that we can use to support off the fund. Last year it was $6 million. Our payroll last year was $14.7 million. So in 2016, we look at it, accounts payable was $11 million versus 13. Remember, we built the clinic and closed that out. So that was that large change. Accounts receivable, $22.3 million. Operating trust, again, $6,040,000. Payroll climbed to $15,600,000. Again, we've added a lot of team members. We had a lot of growth. But at the end, last year, we made just over $1 million. This year, we made over $1.5 million. So we've seen continuous growth and strength in our financials. So, the great community benefit for miners. We provide significant impact on the region. We are, of course, the major employer and we purchase large amounts of goods and services both locally and throughout the state. In 2016, we've employed over 250 team members with a total payroll, as I shared, $15.6 million. And many of those were reinvested, of course, locally. This just shows you a nice summary of that financial impact, what Miners has. So on those wages, the direct was $15.6 million. But there's direct and indirect correlation. And the indirect is then our team members going out, paying rent, a mortgage, buying groceries, buying gas. And that formula adds up to additional $12.3 million. So total wages was $28 million in impact. Supplies and what we purchased throughout the region, $4.2 million, and that equates to about $4.6 million. Purchase services, again, about $4.2 million, and overall total was $4.5 million. The capital investments we made this past year was $4.7 million in equipment and final construction, and that was nearly $5 million in overall. So total impact for this region was $42 million. So tremendous impact. So future capital projects. You will not hear that we are asking for, in the legislative session for 2018, new capital, because we've already committed nearly $2 million in new capital projects we'll be working on. So $1 million in upgrades to our long-term care, including heating, ventilation, and cooling systems. $450,000 in expansion of construction of our new cardiopulmonary and research clinic. $250,000 expanding our long-term care and memory care, including the courtyard at long-term care. The future of healthcare. I wish we all had a crystal ball and knew what was going to happen, right? Well, it's continuously come under fire, and it will in the future. The Accountable Care Act. There will be continued fighting and looking for additional funding for Medicaid expansion. The fact is, they're saying 32% of New Mexicans will be on Medicaid. And by the end of 17, it will approach 38%. So that will continue to come under fire, making sure we fund it properly. Community-based health. How we can better manage both behavioral and primary care. Expanding our medical home, and which means care management. So individuals working with people at home with those chronic conditions, making sure they have the highest quality of life and they stay at home and don't have to be admitted or go to the emergency department. Then, of course, continuous healthcare shortages throughout the nation. It's just not rural, it's just not New Mexico. Throughout this nation, we have national shortage issues. And then, of course, decreased reimbursement, always looking at how they can decrease how much they pay. So, significant challenges to healthcare reimbursement, as I've said, at both the state and federal level. You read the Albuquerque Journal, you see the news, all of the state's budget issues. We are seeing a $700,000 deficit currently on our budget. So we have to find new ways to come up with funding to support the federal match and continue to provide high quality of care. We want to continue to educate our team members and partners down in Santa Fe, making sure we're able to pay the most competitive wages so we have the highest quality team members and we keep them, that we support different healthcare initiatives around prevention, around healthy child, making sure we focus on behavioral health and nursing education and recruitment. We have exceptional community partners and we'll continue to expand those with our city, the county, all of the regional schools, the Center for Sustainable Communities, our Health Council, the Local Behavioral Health Collaborative, and a Trail Alliance we'll be talking about more on healthy walking. And then I also really want to acknowledge and thank our wonderful Board of Trustees with Kathy McQuarrie, our board chair, Scott Berry, our vice, Raymond Rodarte, our secretary treasurer, Dr. Belknap, the physician, and then William Cotton-Jarrell, who is the at-large member. And with that, Kathy, did you want to say anything?
being a part of this, and also just recognize all of the team members that work so hard to provide the quality of care that we as a board and as an institution try to strive to provide to the community. So again, thank you, Sean. And thank you.
So I also want to acknowledge the Medical Foundation. So its full name is Northeastern New Mexico Medical Community Foundation. And this group is very actively involved in helping us, an independent foundation, in the recruitment and retention of practitioners in our area. They've generated over $100,000 in donations to support those initiatives. And you see the auxiliary had a wonderful campaign several years ago for the Living Giving Tree. So when people donate to that, it also goes on to help make sure we have highly skilled people to serve others. So we truly appreciate that. And then with the auxiliary, I'm going to invite Linda Zufak to come on up and talk about the wonderful auxiliary.
Sean is a hard act to follow. We, the auxiliary, have been in existence for 45 years and we're still going strong. We have 58 members at present, and our mission is to advance the interests of the hospital and the patients, and to perform services that benefit the hospital and patients. And the main services that we provide are the gift shop, which is right back there, and our thrift shop that's on 2nd Street. We also put roses in the rooms of all the patients that are coming. We do tray favors and door favors for the patients at long-term care. What else do we do? We do a lot. And with the money that we make from our gift shop and thrift shop, we also provide equipment for the hospital, scholarships, and education to the hospital. And we need volunteers. So if anyone out there can give 50 hours, we would love to have you volunteer and join us. As far as helping with the OB department that Sean mentioned, he tells us we're the only OB department between Pueblo and Santa Fe. And so people come to us to deliver their babies, and we want to buy them the best equipment possible. And we are trying to help the hospital with a letter writing campaign right now. So if anybody would like to donate to help us buy the best quality equipment for the OB department, we'd appreciate that. And we just hope you'll join us. We're going to move to a bigger and better thrift shop this year, so that'll be fun.
And Linda and the whole auxiliary team are very humble, I'll say, but they do just an exceptional job in what they did. Like they talk, over 10,000 hours committed to supporting our organization. They just even recently purchased now a new bilirubin check for our babies in the clinic, where in the past, if they had jaundice or suspect for that, those poor babies had to be stuck and blood drawn. Now it's just a forehead swipe that's painless. So again, they are so committed to advancing our technology and equipment. I can't thank them enough. So thank you. And Anna Wybrew is going to come up? No, kidding. I also really wanted to talk about with the clinic, okay? And if anyone's gone down that hall, we're going to do tours of our new commitment for the clinic. So we are strong, of course, and the emblem is of a tree with deep roots. So our strength, making sure exceptional care and service is committed to each of you. Then we are grounded in commitment and our character and how we serve, because that's why we are here, to serve. And constantly growing with you and for you. So looking at how you can provide input on our direction and where we need to improve areas. With that, I did want to address a couple things with our clinic, and we'll be talking about that on the tours. But for our listening audience, again, with retirement for Dr. Caruana, we can't thank him enough for his 26 years plus of dedicated service to this community, right? And we want to make sure we support that transition, and we are here as partners. So with that, we really ask for patience. If you choose, and you get to choose wherever you want to go for your primary care, but if you choose our clinic, please stop by. They have packets because it's so vital that our practitioners get a full history on your medical conditions, and then they get the proper records to make sure they're providing exceptional care. With that, again, if you don't have an acute care need, those appointments could be, a month or a month and a half out, not to alarm people. We will make sure to get you in, and we have strategies, but we want to focus on those with acute care needs also and getting those taken care of. And we really ask for your support as you work with your other providers on medication refills. That's always an issue. Making sure you don't wait till you only have 3 days left to call. Making sure, and Dr. Caruana has said, he'll work with all of his patients to make sure they have 3 to 6 months filled with their prescriptions, okay? So that will help with transition immensely. So with that, I really want, on behalf of our tremendous 250 team members, thank you very much and thank you for trusting our family to really meet the health and wellness needs of yourself and your family. So with that, I will take any questions.
Sean, there's an unfortunate rumor circulating in the community that we have closed our ICU. Will you put that rumor to rest?
And right now, we have temporarily closed it. Unfortunately, because of staffing that we talked about, ICU critical care nurses are very hard to come and recruit. Unfortunately, we lost 2 of our core specialty and critical care nurses. So temporarily, and I'll reinforce, temporarily, we did have to close it to provide the highest level in care. We are implementing a couple new strategies to advance our telemetry and monitoring capability on medical surgical floor, so we have higher capability there, but we are aggressively recruiting ICU nurses right now. And we did find, it's not the long-term care solution or long-term solution, but we have some agency or travel nurses in critical care coming in early September. So that's when we'll be reopening that department once we fully staff it. And our long-term strategy, as we talked about, increasing competitive wages in those specialty areas and developing those individuals here locally for those high-skilled jobs. So we do have some great strategies, but again, thank you for bringing that up. Other questions? Well, I know you're all hungry, and I do have to thank our wonderful dietary team, because I assure you the food will be exceptional. So with that, I will bid you adieu for tonight. Please, if you have any comments, any input, my office is always open, or you can call me at 445-7722. Thank you very much for coming out.